A very good evening to all of you. How are you all? Today we are going to do the MCQ challenge for orthopedics. Let the people join. So let us begin with the why this is important, orthopedics. Well, it has a good chunk of questions. About 10 questions come from orthopedics. And if you master the basic concepts, that will be very beneficial for you. So let us begin with the orthopedics. Are you able to hear me? If you are able to hear me, please type yes in the chat box. Please type yes in the chat box. There is some problem with the voice. Are you able to hear me? Please type yes in the chat box. So let's begin with the first question in orthopedics. Hello, welcome. So let's begin with the first question. Thank you for responding. Identify the instrument. A. Elizarow's fixator. B. Rail fixator. C. K-nail. And D. Proximal femoral nail. Now let us look into all of the options one by one because anything can be asked as a question. So what is a rail fixator? This is a monolateral fixator available in the form of a rail or a telescopic multi-joint assembly. In this, 6 millimeter pins are inserted into the bone. These pins are attached to different blocks which can move over a track. According to Neet, the bone can be compressed or distracted as in Elizarow's ring fixator. However, it is less versatile as compared to the Elizarow's fixator. And it cannot be used in osteoporotic bone. It can be applied in compound fracture, limb lengthening, and infected non-union. Now, what is PFNA? PFNA means proximal femoral nail anti-rotation device. It is a short intramedullary nail which uses a spiral blade device to obtain fixation in the femoral head rather than conventional screw. What is K-nail? Kunschner's intramedullary nail. German surgeon Kunschner made this nail for fixing fracture of shaft femur. It is hollow, incomplete tube, and there is a slot or gap in the circumference of the hole of nail, which allows it to bend slightly on the tensile surface of femur. As it is hollow, it maintains bone marrow continuity and preserves bone nutrition. It also allows the guide wire to pass. When it is used, it has clover leaf cross section, which prevents its rotation within the medullary cavity. It has two blunt ends, which reduces the chances of cortical. So let's move to the. This is rails fixator. Identify the given splint. A. Dynamic finger splint. B. Cock-up splint. C. Cock-up splint. D. Knuckle bender splint. So yes, this is live. I'm there. So how? Yeah, somebody is giving the answer right now. Very good. Next question. Okay, okay. I will move fast. Well, there is a issue with the system, so it is hanging. So let's move to the next question. So there has been some issue. So I will be back. Black screen is there. I will come backward. No, just 1 minute, please. Just 1 minute. I will back soon. Are you able to see the MCQ? Yeah, it's back. Kindly type yes if you are able to see the MCQ. So, a football player falls on an outstretched hand while kicking the ball and felt pain at the wrist joint immediately after falling. Identify the fracture. Look at the X-ray carefully and identify the fracture. A. Is it a Galeazzi fracture? B. Coles fracture. C. Monteggia fracture. D. Rolando fracture. Well, what is your take on this? Anybody, please? It is Galeazzi fracture. Let's move to the next question. What is the use of given instrument? A. To hold the bone and plate. B. To hold bone fragments with traction. C. To cut the bones. D. For creating a gap. Well, it is a plate holding force. It is used to hold the bone and plate. So correct option here is A. Earliest sign of compartment syndrome of leg. Again, this compartment syndrome of leg is very important as far as NEET PG or INST is concerned. So the four options are A. Tingling or numbness. B. Skin mottling. C. Pulselessness. D. Pain on passive stretch. Well, the correct answer here is pain on passive stretch. What is compartment syndrome? Anybody, please? What is compartment syndrome? You can type in the chat box. See, this compartment syndrome is more common in lower limb. It is common in high risk injuries, for example, fracture of elbow, forearm bones, proximal third of tibia, multiple fractures of hand or foot, crush injuries, and circumferential burns. The clinical feature is it is characterized with pain with passive motion of fingers and toes. There is pulselessness is there, pallor is there, paresthesia is there, poikilothermia is there, and paralysis is there. The pain is out of proportion to clinical situation is the usually the first symptom. Pain on passive stretching is most sensitive sign prior to onset of ischemia. So the correct answer here is pain on passive stretch. What is the most common sequelae of traumatic shoulder dislocation in young adults? A. Frozen shoulder. B. Recurrent shoulder dislocation. C. Normal shoulder healing and movement. B. D. Subcapsular tendinitis. Well, there is a recurrent shoulder dislocation. In the fracture seen in X-ray below, what is the most commonly expected vascular injury? A. Brachial artery. B. Radial artery. C. Ulnar artery. D. Cubital vein. This brachial artery. You go to the description box. There you will get a link. Just click the link there. You will reach a WhatsApp group. There you will get the details of the ultimate NEET PG breakthrough blueprint masterclass covering in 90 subjects in 3 days. It will help you your revision. It will take your revision to the next level. If you are new to my channel, please subscribe and hit the notification button. So whenever I come, usually I come live in the evening between 7 to 8. So you can also come live at that moment and we can discuss the MCQs also. If you have any difficulty in any topic, you can WhatsApp me directly on the number which is flashing again and again. And if you want a lecture on any of the difficult topics, please share it on the WhatsApp group. I will upload the corresponding video. What is the eponym for the fracture shown below? A. Galeazzi fracture, B. Monteggi fracture, C. Smith's fracture, D. Coles fracture. It is Monteggi's fracture. An athlete suffers a fracture as shown in the X-ray below. Well, it is X-ray of the knee. How is this fracture is managed? A. Tension band wiring. B. Compression plating. C. Internal fixation. D. K-wire fixation. Well, it is tension band wiring. Which part of second metatarsal is involved in the march fracture? A. Head. B. Neck. C. Shaft. D. Base. It is neck. Which of the following is incorrect about PCL? It is the main restraint in the posterior dryer test. It is an extra synovial structure. B. It is the main restraint to internal rotation. So correct answer is main restraint to internal rotation. About giant cell tumor, all are true. Commonly present in 20 to 40 years of age group, matrix consists of proliferating mononuclear cells. Osteoclast giant cells constitute the proliferative component of tumor. It is osteoclast giant cells. What is the diagnosis? Well, it is a giant cell tumor. B. Identify the deformity. A. Swan neck deformity. B. Boat neck deformity. C. Jersey finger. D. Mallet. It is swan neck deformity. Glucosamine supplementation is given in A. Arthritis. B. Diabetes. C. Cataract. D. Asthma. It is arthritis. Patellar lung syndrome scar is present at superior polar patella and impinging on the A. Femoral component during flexion, femoral component during extension, inferior pole during flexion, superior pole during extension. It is femoral component during extension. More specific for diagnosing ankylosing spondylitis is HLA-B27 bilateral sacroiliitis lumbar movements ESR. It is bilateral sacroiliitis. What is the most likely cause of abnormality seen in the wrist X-ray of the child below? A. Scaphoid fracture. B. Colles fracture. C. Osteoporosis. D. Rickets. It is rickets. A 75-year-old female had a fall and intercognitive fracture. This is due to A. Osteoporosis, osteopetrosis, Paget's disease, metastasis. It is osteoporosis. A 55-year-old male presents with severe backache for 10 days and urinary incontinence with history of intervertebral lumbar disc collapse. There is no history of fever or weight loss. What is the likely diagnosis? A. Part spine. B. Multiple myeloma. C. Quad icona syndrome. D. Mode 1 metastasis. It's quad icona syndrome. All of the following are true about spinal shoulder except A. Associated metamyelia, most commonly seen with Klippel-Feil syndrome, usually associated with dextrocardia, associated congenital scoliosis. Correct answer here is usually associated with dextrocardia. What is the likely diagnosis of image? Coxa magna, coxa valga, coxa vara, coxa sultans. It is coxa vara. Neck shaft angle of less than 125 degrees referred to as coxa vara because where the neck normally aligned to the pelvis. Meralgia paresthetica, well, the correct answer is lateral cutaneous nerve of thigh. And for the deformity seen in the given picture, hallux valgus, hallux varus, cubitus valgus, cuboid nodule, it is hallux valgus.